I'm Loretta Nastoupil. I'm a hematologist and medical oncologist at Mercy Hospital. Well, like most, I have been impacted by cancer in terms of several family members, me personally. And so I always wanted to understand how the body worked so that we could potentially understand when it goes awry. And importantly, how to navigate that very challenging situation. That's partly why I moved back to this area, getting closer to my rural roots, but also people that, like my family members, who struggle navigating a very complex medical system. So if I could provide cancer care to patients in a way that they felt comfortable and could understand it, then maybe I'm serving those that, again, I'm comfortable with. What's really unique about Mercy is, one, we're geographically isolated, and so patients are often coming to us because they live in this area, but traveling can be quite challenging. It's a beautiful area, and so obviously there are people who want to live here because it's very desirable. But what was quite striking to me is that you have very high quality medical subspecialists, and I think that's because of the area. It's quite a draw, but also I think there's a calling to provide care to patients that don't have access to it, again, being so isolated in many ways. I think the most important thing that patients need to understand is we really want to help. I mean, that's why most people go into medicine. Obviously, we're curious about the disease and we're curious about modern therapies that can help eradicate disease. And there are a number of new treatments that have come along just in the last few years that have made cancer a very manageable problem for the vast majority of people. There's still those situations where our treatments are lacking. And so still being compassionate and empathetic for patients, even when our treatments fail them, I just want them to know that we're all here to help. And we're hoping to offer the latest and greatest that we can to our patients in this area. The first visit is usually the most stress-inducing because oftentimes they're coming with a new diagnosis of cancer or a blood disorder that's not very well understood. And so our first visit is really just trying to meet the patient where they are. What do they currently understand about their disease? Walk them through any additional testing that needs to be done, and then ultimately give them a treatment plan. And that can be personalized to what their goals and needs are, hopefully optimized based off of what the latest and greatest treatment is, and oftentimes delivering that care here close to home. Well, there is absolutely a reason why we live here. So there is no better place if you enjoy the outdoors. And so it is seasonal. We enjoy hiking, fishing, camping. In the wintertime, we do a lot of downhill skiing. And I just recently got into road biking, so I'm looking forward to this iron horse that everyone in Durango has done at some point in their time.